This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman with Juan Gonzalez.
Well, the World Health Organization is now saying the number of reported cases and deaths of Ebola in West Africa vastly underestimates the scale of the outbreak. The official death toll from the Ebola outbreak is now at 1,069 since February. Guinea has become the fourth country in Africa to declare a national health emergency as it battles the spread of the deadly Ebola virus in the worst outbreak since the disease was discovered in 1976. The outbreak began in Guinea, where it has killed 377 people. It has since spread to Liberia, Sierra Leone, and Nigeria, which have all declared a national health emergency.
Last week, the World Health Organization said the unprecedented outbreak of the Ebola virus was an international public health emergency. Ebola's initial flu-like symptoms can lead to external hemorrhaging and internal bleeding, which can lead to organ failure. The disease is highly infectious and can kill up to 90% of those afflicted. Patients have a better chance of survival if they receive early treatment. There's no cure for Ebola, but the first consignment of the experimental drug ZMapp has arrived in Liberia from the U.S. The World Health Organization's approved the distribution of unproven drugs to help address the Ebola outbreak. World Health Organization Assistant Director General Marie-Paul Keeney said the decision was made despite tests that failed to prove the drugs are safe and effective.
The first time we have a range of potential treatments and vaccines, they could be potent assets supporting our efforts to control Ebola virus disease. However, while several of these treatments have been proven to be very effective in non-human primates, and I mean mostly rhesus macaques, none have undergone the test in humans necessary for licensing as proven safe and effective treatments. That does not mean that they are not safe. It simply means we do not have the evidence from human studies to say that it is certain that they are safe and efficacious.
That was WHO Assistant Director General Marie-Paul Keeney. The outbreak has sparked an international debate over the ethics of giving such untested drugs to the sick and of deciding who should get the drugs.
To talk about the implications of the crisis, we're joined by three guests. Laurie Garrett is with us, Senior Fellow for Global Health at the Council on Foreign Relations. She won the Pulitzer Prize in 1996 for her coverage of an Ebola outbreak in what was then Zaire, now the Democratic Republic of Congo. She is the author of two best-selling books, The Coming Plague, Newly Emerging Diseases in a World Out of Balance, and Betrayal of Trust, The Collapse of Global Public Health. In Washington, D.C., we're joined by Lawrence Gaston, University Professor and Faculty Director at the O'Neill Institute for National and Global Health Law at Georgetown University, Director of the World Health Organization Collaborating Center on Public Health Law and Human Rights. And in Providence, Rhode Island, we're joined by Adia Benton, a medical anthropologist at Brown University. She's conducted research on infectious disease in Sierra Leone over several years. We welcome you all to Democracy Now! Let's begin with Laurie Garrett. Laurie, just explain what Ebola is for starters, and then talk about what you think we should understand about it.
Ebola is an RNA virus that infects your endothelial cells, which are the linings of blood cells and vessels, capillaries, puncturing microscopic leaks in them, which grow with time, and you begin to lose all the fluids from your circulatory system into your body as a whole, out of your eyes, out of your nose, out of your mouth, every orifice of the body. Those fluids are filled with virus, and anyone who touches those fluids and then, touches their eye or rubs their nose will become infected. And some of the numbers being tossed around, I heard you say 90% mortality rate. These are gross exaggerations, but it is a truly horrible disease. In only one outbreak did the death toll reach 90%. That was 1976. I was in the 1995 outbreak, which until now was the largest. The current one is more than 3 times larger. And the death toll was closer to 70%. But it's still, I mean, my goodness. When you see an average flu in circulation and you think it's a bad flu, you're under 1% mortality rate, to put that in comparison.
And the response, the worldwide response to this outbreak, how do you assess how that has gone so far?
Outrageous. Outrageous. I've been stunned and flabbergasted since March, when this was first reported from Guinea. And I concur completely with the statements made by Médecins Sans Frontières or Doctors Without Borders. They've consistently said, we're the only ones out here, help. Hello, everybody, there's an Ebola epidemic going on. Hello, it's spreading across a border. Oh, it spread another border. What are you all waiting for? I have a piece right now in Foreign Policy that begins, "World, you just don't get it." The scale of what we need to be doing versus what we are doing is, log scale differential. All the healthcare workers are burned out. Let's put this in perspective. Excuse me. And there's no water here. Put this in perspective. Before we had an epidemic, these three countries had three of the worst healthcare systems on the planet and the poorest people on the planet. And not one of those governments was spending more than $100 per capita annually on all forms of health, which in this country keeps a household stocked in aspirin and ibuprofen. And Liberia had about 200 physicians to service 4 million people. About half of those physicians were non-Liberians, foreigners. Ebola struck, a lot of those foreigners left town. They're down now to 50 physicians to deal with everything. Now, as the Ebola crisis gets worse, cardiac patients are going untreated. Women are giving delivery without assistance. You've got automobile accidents with people's legs cut off and nobody will accept them into an ER. It's so much bigger than people realize and that people accept. What we need is hundreds of healthcare workers in these countries immediately. Hundreds. And we're getting dribs and drabs. And we don't need, I know you have a lot of very motivated viewers and listeners. We don't need the do-gooder who's never been out in a crisis before. It's very nice of you to volunteer, but you're not necessary. We need people who have history of working under great trauma, who know how to work in the tropical heat, who know how to maintain personal infection control, and are prepared to deal with some psychologically devastating things.
And the implication of the disease spreading into Nigeria?
Unbelievably important. Now, let's be cautious. At this moment, we have no evidence of secondary transmission. So everybody that's been proven to have Ebola in Nigeria got it directly from this one fellow, Patrick Sawyer, a Liberian businessman who flew for a meeting to Lagos and contaminated people who were part of his entourage and the medical providers who cared for him.
A Liberian American, right?
A Liberian American. However, one of the nurses under quarantine, a suspect but not proven case, fled quarantine a couple of days ago, went to the city of Enugu, and now more than 120 people of her contacts are under observation. In addition, at least 2 of the individuals, one his escort and the other a physician, have died of Ebola in Lagos. The concern, of course, is if it gets beyond that circle, because you cannot ask for a more chaotic city than Lagos, Nigeria. Anybody that's there, has ever been there, knows there's no such thing as a street map for most of the city. Contact tracing, finding, who might have infected who. Oh my goodness. And on top of it all, they have a national doctor's strike, they have a civil war, and they have a national election, and oh yes, Boko Haram.
Adia Benton, you have been in Sierra Leone over the years, conducting research on infectious disease there. You're a medical anthropologist at Brown University. Can you share your view on what should be done right now and how we are looking at this issue?
Well, I absolutely agree with Lori Garrett's concerns. We certainly need more health workers on the ground. We need much more protective gear. Many of the health workers that I've been watching on Twitter are curious about how they're going to continue to do their work or how they're going to be protected if they are to head to the front lines. I don't want to underestimate the importance and significance of this disease and of this outbreak. I've been worried about being alarmist but also being able to sound the alarm, because we have to also keep in mind that we don't want people to panic. We want people to do the jobs that need to be done, which is to have an influx of health workers who can actually do the job, who understand how to work in an outbreak situation, and who know how to do infection control. I do have some friends at the CDC who've been deployed, and they're going to be helping with coordinating data efforts, but I haven't heard from nearly as many of my medical friends who are doing the same. So this is something that I think is really fundamentally important. Before, and I think Laurie Garrett pointed out, before this outbreak, the health system was woefully inadequate. And it was always perceived to be a place where you go either when you're seriously sick, or if you maybe were not, obviously you weren't sure if you were going to live or die. And so for this disease or this outbreak to have overwhelmed the health system, I think has been a serious problem for everyone. I think they're also significant. I think there's right now they're cordoning off Kinama and Kailaon district, which are the hardest hit in Sierra Leone, and that's causing all kinds of other economic and sort of health and political problems. And those are things that we also should be concerned about and concerned with, because that's ultimately going to affect how people on the ground are responding to the response to this outbreak.
Yeah, I'd like to ask Lawrence Gostin of Georgetown, this whole issue of quarantining, and especially large communities, has created quite a bit of controversy on the ground there as well. Could you talk about that? Because you've specialized in trying to look at quarantine efforts.
Yeah, I mean, they have tried to use a cordon sanitaire, which is basically a very large guarded area. But they've used almost a medieval form of quarantine with soldiers, blockades. People who are in the quarantine area are very frightened, and I think deservedly so. And they're frightened not only because they're in a hot spot, a hot zone of Ebola, but also with roads blocked, there's food's expensive and getting scarce. There are no medical supplies, and the basic needs, psychosocial and medical needs, are not being met. And so this is a really inhumane way of trying to do that. We never should have come to this. I think that Ebola is a disease that can be contained if you've got a strong health system, but we've provided no international assistance of the level and sustainability that's needed to build health systems in the world's poorest countries. And this is what happens. And now we have these large quarantine areas. If we did want to do a quarantine, we have to do a smart quarantine, a modern quarantine where we provide humane care, where we give people incentives to stay where they are, psychosocial support, education, nutritious food, medical care, and it's not policed by armed soldiers. The militarization of a disease isn't usually what works. It just causes a lot of fear and panic.
I'm going to have to very much disagree with Larry on this. We're old friends, but Larry, I don't think you're right. Here's why. First of all, I was in the Ebola epidemic in '95, and we, in fact, did do cordon sanitaire. It was the only thing that worked, and it's often ignored. Mobutu was the brutal dictator at the time, and he simply summarily cut the whole region off with soldiers surrounding Kikwit, blocking the highway, no airplanes, etc. The people were stranded, terrified, exactly as Larry is describing. Within that cordon sanitaire district, which enclosed about 500,000 people, individual isolation centers were also set up. And the Red Cross removed every single ailing person from the families, regardless of objections, which sometimes became violent. Many of those Red Cross volunteers themselves contracted Ebola as a result of those altercations. And they would bring them into quarantine hospital facilities. We have no other tool. We don't have anything else. Now, my real problem is, first of all, I agree with Larry, we waited way too long to get to this point. So now it's draconian. And, and secondly, now what's happening de facto is that because the rest of Africa does not believe that Sierra Leone, Guinea, and Liberia are behaving in a competent fashion, and doesn't trust that they can stop the epidemic, essentially a de facto cordon sanitaire is around all three countries. They've lost all their trade. Abidjan will no longer ship goods out of the three countries, which pretty much landlocks their trade. They have no more airplane flight landings going on anywhere in the world. So the failure to use the tool of cordon sanitaire strategically early in the epidemic, and now because of the attacks on healthcare workers, in many cases life-threatening, against MSF and other medical providers by angry mobs, yes, you had to have the military come in. You can't ask MSF to keep risking their lives. They're already risking their life to be in front of a virus, and now you're asking them to also put up with people that come in with machetes and guns and try to kill them? No, they need military protection.
We have to break. No. We're going to come back to this discussion. Okay, Laurie Garrett is the Pulitzer Prize-winning journalist who won the Pulitzer Prize for reporting on the Ebola outbreak in now Democratic Republic of Zaire. We're also joined by Georgetown University professor Larry Gaston, as well as Brown medical anthropologist Adia Benton. Stay with us.